the Public Relations Unit, during this COVID pandemic, start from the onset when we had no case from the preparation period, it was a question of when, not if we shall get a case. So we employed a lot of measures to ensure that communication reaches the real person who is going to be battling this prevention of COVID. We sent out prevention messages to the community through media houses, through social media, and basically that was between January and February and March, until we received the first case in March. When we received the first case in March, the media played a critical role in ensuring that the people are always updated on how many cases and on how they can prevent this COVID-19. And as a department, we also ensure that every day we send out message through infographics, designs that cited out the number of cases, the contacts, and the disease burden of COVID-19. We shared every day, starting from our turnaround started at 8 p.m. at the beginning. It moved to 11 p.m. It moved to 1 a.m. Then it moved to 8 a.m. in the morning, then 11 a.m. until it went after days and after days. Our motive was to make sure that we don't leave a communication vacuum and give space for people to spread fake news, which would damage our efforts in communicating this pandemic. One thing that also helped us, because we knew with COVID we couldn't gather people around and have meetings, and ideally we wanted other services and treatment for other services to continue. So what we did, we had trainings with the support from our IT department. We trained all healthy workers and healthy administrators on how they can able communicate using the available communication channels which were there, that is Zoom and the Teams, the Microsoft Teams, and other facilities that were available. So our team went to health facilities, training them to ensure that we can always continue engaging with them. We received donations on some equipment, which included some screens from partners and well-wishers on how we can keep communicating. These equipments were put at the Ministry of Health, and others were taken to the facilities themselves. And one other thing I can't forget, which has done a critical role, is the call center. The call center was bombarded by a lot of calls, the questions. People were scared, they wanted to know about COVID, and the only way they could access this information about COVID was the Ministry of Health. And given the fact that people would not come physically, so the only way they would use was the call center. The call center initially used to have about 5 staff. Because of the increase in the demand of information, it was increased during COVID. We increased the staff, we increased the phones in the call center with support from MTN at some point and UTL. We had to expand to also where they sit, so as we can receive these calls and respond to them on time, so as we can avoid a communication vacuum. Going forward, we are working together with NITA Uganda to make sure that we connect all healthy facilities with internet, reliable internet, so as we communicate via the digital platforms, because analog is moving out, and in this 21st century we have to use internet communication to reach out to our people. So this is entirely what we are doing to make sure that people receive information, not withstanding the COVID pandemic. Thank you.